ADHD is not a lack of focus. This video explains what Attention Deficit Hyperactivity Disorder actually is, how it shows up in different ways, how it is diagnosed, and what treatment looks like. For many people, ADHD explains why the mind feels constantly busy, while important details still slip away, which often leads to trying harder, planning more, and still feeling behind compared to everyone else. Over time, that cycle creates frustration, shame, and the belief that something is personally wrong, even when effort has never been the problem. ADHD stands for Attention Deficit Hyperactivity Disorder. Although the name does not fully describe what is happening in the brain, this condition is not about laziness, weak discipline, or a lack of motivation, and it is not a flaw in character or intelligence. ADHD is a neurodevelopmental condition, which means the brain handles attention, time, and motivation differently from the start, and those differences shape daily life in very real ways. Many people do not outgrow ADHD simply because they age, and that expectation alone causes harm. What often changes is not the brain, but the environment, especially when structure disappears and demands increase. For women in particular, ADHD frequently goes unnoticed for years, which means the struggle happens quietly and without support. Clinically, ADHD appears in three main types, and each one affects daily life in its own way. The first is inattentive ADHD, which is the type most often overlooked, especially in girls and young women. People with this presentation lose items often, forget deadlines, miss details, and feel overwhelmed by tasks that seem simple to others, even when they care deeply and want to do well. The result is a constant mismatch between effort and outcome, which often leads others to misunderstand the behavior as disinterest. Another presentation is hyperactive impulsive ADHD, which is the version most people recognize. Restlessness, fast-moving thoughts, difficulty waiting, interrupting, and acting before thinking are common, and these behaviors are not intentional choices. The brain moves quickly, which means the pause between impulse and action feels shorter, and control becomes harder to maintain. The third presentation is combined ADHD, and it is also the most common. People with this type experience both inattentive and hyperactive symptoms, which means managing daily life requires constant adjustment. Over time, that effort can become exhausting, even when the person appears functional from the outside. ADHD often feels harder as people get older, and the reason has little to do with ability. Childhood environments provide built-in structure through schedules, reminders, and supervision, which helps offset symptoms without anyone noticing why. Adult life removes much of that structure, and responsibilities multiply, which exposes the gaps that support once filled. Diagnosis focuses on long-term patterns rather than personality traits or isolated struggles. Symptoms must begin in childhood, appear in more than one area of life, and interfere with daily functioning to meet diagnostic criteria. For many women, masking behaviors delay recognition, since overcompensation hides the struggle while anxiety, self-criticism, and burnout quietly grow. Treatment is where clarity turns into progress, because ADHD is treatable. Support can include behavioral therapy, skills-based coaching, medication, or a combination tailored to the individual. Medication helps the brain filter distractions, so effort leads to results, while therapy focuses on systems such as time management, organization, and energy regulation rather than relying on willpower alone. For children, treatment often begins with behavior therapy that involves parents, which helps the entire family support consistent routines and skills. For school-aged children and adults, medication alone or combined with therapy is considered the most effective approach. Both stimulant and non-stimulant medications are used, and for many people they significantly improve focus and reduce distraction without changing personality. Living with untreated ADHD affects more than productivity. Confidence erodes, relationships strain, and self-trust weakens when effort never seems to pay off. The longer symptoms go unrecognized, the louder self-blame becomes, even though the underlying issue has never been a lack of care or effort. The next step is not self-diagnosis and stopping there. Writing down persistent symptoms, noticing when they first appeared, and bringing that information to a licensed professional creates clarity instead of guesswork. With proper support, people with ADHD learn how to work with their brain rather than against it, which changes how life feels and what becomes possible. When someone spends years asking why everything feels harder despite constant effort, the answer often lies beneath the surface, waiting to be understood. If any part of this felt familiar, tell us how ADHD has shown up in your own life and how you handle it. Please share your experiences in the comments section, because it will help someone understand that they are not alone.